cardiovascular disease in people who've had autoimmune conditions is a real problem. So it's an interesting study that came out looking at this in a different way. So we know that our patients with chronic autoimmune conditions have higher rates of cardiovascular disease, strokes and heart attacks long term. This is an interesting study that basically looked at patients who have autoimmune conditions, including lupus, psoriatic arthritis, rheumatoid arthritis. This was a study that was presented at a cardiac imaging meeting, and this was done by one of the Harvard hospitals. They, over 7 years, looked at their patients that have autoimmune conditions that had CAT scans that were done, CAT scans of the chest. Interestingly, not looking for heart disease in these CAT scans. They were looking for just other things. They were looking at things like, do they have infections? Do they have cancer? They had other reasons for getting CAT scans of the chest. They were not even thinking about or looking for coronary artery disease. What they did was, retrospectively, they then ran an AI software over the images to look to see if they have any coronary artery calcification in their heart arteries. The presence of calcification in those arteries is consistent with coronary artery disease, and the more calcification you have in the arteries, the more the risk of having a heart attack is. And what they found in this group is that over 50%, 53% of people had coronary artery calcification. On top of that, this was a group of folks who have a chronic autoimmune issue, but who had no known history of heart attacks, strokes, or coronary artery disease. So this is just completely new diagnosis that they were finding. So a couple things. Number one, what an incredible use of AI, right? What a great use of technology to take a population that's potentially at risk for heart disease and then to overlay the AI on just routine other imaging and find out if they actually have that as a condition. And then you can do something about that. Number two is the things that put you at risk for heart disease are things like high blood pressure, diabetes, high cholesterol, obesity, and also chronic inflammation. So the way heart disease develops is that in the outer lining of your arteries, you can develop what's called a plaque. It's a buildup of some cholesterol and some inflammation. And if that inflammation gets too much, you can get a rupture of that, which then occludes or blocks the artery, which then leads to a heart attack or a stroke. So in folks that have chronic inflammation, like our autoimmune patients, they're at higher risk for heart attacks and strokes because of that. So what's amazing is that we can do a great job at controlling inflammation and controlling the overall disease process, but controlling the cardiovascular disease process is still a work in progress. And so it's incumbent upon our patients and for us as physicians to really focus on our patients' metabolic health. And that includes, again, optimizing weight, optimizing blood pressure, controlling your blood pressure, controlling your cholesterol, and doing all the correct things to optimize your metabolic health, because coronary artery disease is at such a high risk. And this study, to me, really exemplifies it, that even in people who don't know that they have coronary artery disease, who've never had strokes, who've never had heart attacks, over 50% of our patients with rheumatic or autoimmune conditions are at risk.